Senolytic drugs represent a compelling therapeutic strategy in the emerging field of anti-aging medicine, aiming not to prevent telomere shortening directly, but to address one of its most detrimental consequences: the accumulation of senescent cells. These cells, which have exited the cell cycle due to critically short telomeres or other stressors, persist in tissues and secrete a mix of pro-inflammatory factors, growth regulators, and proteases known collectively as the senescence-associated secretory phenotype, SASP. This pro-inflammatory environment damages neighboring cells, accelerates tissue degeneration, and can promote further telomere attrition through chronic oxidative and replicative stress. By selectively clearing these dysfunctional cells, senolytic drugs offer a way to break this vicious cycle and restore a more youthful cellular environment. The rationale behind senolytic therapy is grounded in robust evidence from both animal and early human studies. In aged mice, periodic administration of senolytics, such as dasatinib, a cancer drug, and quercetin, a plant flavonoid, has led to improvements in cardiovascular health, cognitive function, bone density, and insulin sensitivity. Importantly, these benefits were achieved not by halting telomere shortening per se, but by reducing the toxic burden imposed by senescent cells, which often emerge in response to telomere dysfunction. By removing these chronically damaged cells, tissues regain their regenerative potential, stem cell function is preserved, and remaining healthy cells are spared from the SASP-driven stress that can hasten telomere erosion. Quercetin, as a natural compound with senolytic properties, offers a particularly promising and accessible entry point for senescence-targeting therapies. It works in combination with other agents to induce apoptosis selectively in senescent cells by targeting pathways like BCL2 and PI3K/AKT, which these cells use to resist cell death. Similarly, navitoclax, another BCL2 inhibitor, has shown senolytic activity, but with stronger potency and greater risk of side effects. What unites these compounds is their capacity to reduce the inflammatory and oxidative stress load within tissues, two primary drivers of accelerated telomere shortening. Though telomere lengthening does not appear to be a direct effect of senolytic therapy, its downstream benefits are substantial. One major advantage is the restoration of a healthier intercellular environment, which supports telomere stability in nearby non-senescent cells. Removing the SASP also helps preserve stem cell niches, regions of tissues where regenerative cells reside and where telomere preservation is particularly crucial for long-term health and repair. In this sense, senolytic therapies may function not just as damage removers, but as enablers of cellular youthfulness by sustaining an environment in which telomere erosion is slowed rather than accelerated. Another positive outcome is the potential synergy between senolytics and other longevity interventions. For example, combining senolytics with telomerase activators, autophagy enhancers like rapamycin, or hormetic agents like quercetin in different forms may produce layered benefits: reduced senescence burden, improved cellular repair, and slower telomere attrition. Likewise, integrating senolytics with lifestyle interventions such as exercise, intermittent fasting, or antioxidant-rich diets could amplify results, as those strategies also aim to minimize cellular stress and preserve genomic integrity. Safety remains a central concern, particularly because senolytic drugs are designed to trigger apoptosis, a potent cellular process. However, the targeted nature of senolytics, especially when used intermittently, appears to minimize systemic toxicity in preliminary studies. Clinical trials such as those involving dasatinib and quercetin in patients with idiopathic pulmonary fibrosis or diabetic kidney disease have demonstrated good tolerability, reinforcing the idea that periodic clearing of senescent cells might be feasible and safe in humans. As research advances, more refined senolytic candidates are being developed, including peptides, antibody-drug conjugates, and small molecules that target senescent cells with greater precision. These tools could eventually allow for customized interventions, where senescent cells in specific tissues or disease contexts are eliminated without affecting normal cell populations. Such precision would be invaluable in maintaining telomere health in vulnerable organs like the brain, heart, and bone marrow, where stem cell integrity is vital to long-term function. In summary, while senolytic drugs do not directly rebuild telomeres, they remove one of the greatest accelerants of telomere erosion: the toxic presence of senescent cells. By clearing these cells and reducing the systemic inflammatory burden, senolytics create a biological climate more conducive to telomere maintenance and overall cellular resilience. Their promise lies in both prevention and rejuvenation, slowing the advance of cellular aging while improving the quality and function of tissues already affected. As our understanding deepens, senolytic therapies may become a key component of holistic strategies to extend health span, protect telomeres, and restore the regenerative capacity of aging bodies.